A psychiatric assessment is like a detective's magnifying glass, helping us understand the complexities of a person's mind. It involves questions, observations, and tests to evaluate someone's mental state. This assessment guides treatment decisions and helps clinicians understand unique needs. Imagine a patient walks into a therapist's office, their face etched with worry. The therapist, through observation and questioning, pieces together the puzzle of their distress. This process forms the essence of a psychiatric assessment. It's about understanding the whole person, their strengths, struggles, and journey. This holistic approach allows for effective and compassionate care. Just as a doctor needs a stethoscope, a mental health professional needs assessment tools to understand the mind. Psychiatric assessments pave the way for healing and recovery. Imagine thoughts as threads weaving a tapestry of the mind. A psychiatric assessment examines these threads for their logic, speed, and coherence. Are the thoughts connected logically, or do they jump haphazardly? Is the person's thinking fast or slow? Do their thoughts make sense to others, or are they muddled and unclear? For example, someone experiencing tangential thinking might start talking about their day, but then veer off on unrelated tangents, never returning to the original topic. In contrast, someone with circumstantial thinking might provide excessive and unnecessary details, making their point indirectly. Another important aspect is the rate of thought. A person experiencing a manic episode might exhibit rapid, racing thoughts, jumping from one idea to another quickly. Conversely, someone with depression might have slow, labored thinking, finding it difficult to process information. Understanding these thought patterns is crucial. They can signal underlying mental health conditions and guide treatment strategies. For instance, recognizing tangential thinking can help differentiate between anxiety and attention deficit/hyperactivity disorder, or ADHD. By carefully analyzing a person's thought process, clinicians can gain valuable insights into their inner world and tailor interventions to address their specific needs. Memory, the ability to store and retrieve information, is critical. Imagine memory as a vast library with sections for immediate recall, short-term and long-term storage. Immediate recall is like the entrance hall, holding information briefly. Clinicians assess this by asking for immediate repetition of numbers or words. Short-term memory, like the reading room, holds information for minutes to hours. Clinicians might ask for recall after a 5-minute delay. Long-term memory, the library's stacks, stores information for years. Clinicians assess this by asking about significant life events. Difficulties in these domains can indicate underlying conditions. For example, difficulty with immediate recall might suggest attention problems. Evaluating memory helps identify cognitive impairments and guide interventions. The way a person moves can speak volumes about their mental state. Psychomotor agitation, for instance, is like a pot of water about to boil over. It manifests as restlessness, pacing, and an inability to sit still, often accompanying anxiety or mania. On the other hand, psychomotor retardation is like a slow-moving river. It involves slowed movements, reduced facial expressions, and a monotonous voice, often associated with depression. Tics are sudden, repetitive movements or vocalizations like eye blinking, shoulder shrugging, or throat clearing. These involuntary actions can be distressing and interfere with daily life. Tremors, on the other hand, are rhythmic, shaking movements, often affecting the hands, but also possible in other body parts. While some tremors are normal, others can indicate neurological or psychological conditions. Observing these motor behaviors provides valuable clues about a person's emotional state and potential neurological or psychological disturbances. It helps clinicians understand the severity of their condition and tailor treatment accordingly. Section 5. Speaking the unspoken, understanding speech patterns. Just as a conductor guides an orchestra, speech patterns can reveal the rhythm and flow of a person's thoughts and emotions. The rate, volume, and content of speech offer valuable insights into their inner world. Imagine someone with pressured speech talking rapidly, their words tumbling over each other as if they can't get the thoughts out fast enough. This often accompanies mania or anxiety, reflecting a racing mind. Conversely, someone with poverty of speech speaks minimally. Their response is brief and lacking in detail. This flatness of speech can be a symptom of depression, reflecting a slowing of thought processes. Echolalia, on the other hand, involves repeating words or phrases spoken by others. This echoing can occur immediately after hearing the words or after a delay, often seen in autism spectrum disorder. By paying close attention to these variations in speech, clinicians can gain a deeper understanding of a person's emotional state, thought processes, and potential underlying conditions. This allows for more accurate diagnosis and tailored treatment plans. Section 6, the social dance, exploring interpersonal dynamics. Humans are social creatures navigating a complex dance of relationships. A psychiatric assessment explores this social dimension, evaluating a person's social skills, empathy, and conflict resolution abilities. Imagine someone with strong social skills effortlessly navigating conversations, reading social cues, and building rapport with others. They can empathize with others' feelings and handle conflicts constructively. However, some individuals struggle with interpersonal challenges. They might misinterpret social cues, have difficulty expressing their needs, or struggle to manage disagreements effectively. This can lead to social isolation, conflicts, and difficulty maintaining healthy relationships. Clinicians assess interpersonal functioning through observation, questioning, and sometimes standardized assessments. They explore the person's social history, relationship patterns, and any current interpersonal difficulties. Understanding these social dynamics is crucial. It helps clinicians identify areas where the individual might need support, such as social skills training, communication therapy, or conflict resolution strategies. By addressing these challenges, individuals can improve their relationships, reduce social anxiety, and enhance their overall well-being. Section 7. The realm of psychosis. Recognizing the disconnected mind. Psychosis, like a shattered mirror, reflects a distorted perception of reality. It involves hallucinations, delusions, and disorganized thinking, disrupting a person's connection with the world around them. Hallucinations are sensory experiences without any external stimuli. A person might hear voices when no one is speaking, see visions, smell odors that aren't there, feel phantom touches, or even experience tastes that have no source. Delusions, on the other hand, are firmly held beliefs that contradict reality. A person might believe they are being followed, plotted against, or have special powers, despite evidence to the contrary. Disorganized thinking manifests as jumbled speech, difficulty following conversations, and illogical jumps between ideas. It's like a train derailing from its tracks, making communication challenging. Recognizing psychosis is crucial for early intervention. Clinicians carefully assess for these symptoms through interviews, observations, and sometimes specialized questionnaires. They differentiate between different types of hallucinations, delusions, and thought disorders to guide treatment decisions. Early detection and treatment of psychosis can significantly improve long-term outcomes, reducing relapses and improving quality of life for individuals experiencing these distressing symptoms. Section 8. Avoiding pitfalls. Common errors in assessment. Even the most experienced clinicians can make mistakes in psychiatric assessments. One common error is anchoring bias, clinging to an initial impression even when presented with contradictory information. Another pitfall is confirmation bias, selectively seeking information that confirms pre-existing beliefs while ignoring evidence that challenges them. This can lead to inaccurate diagnoses and ineffective treatment plans. Availability bias involves overestimating the likelihood of something based on its vividness or recent exposure. For example, a clinician who recently treated a patient with bipolar disorder might be more likely to diagnose it in subsequent patients, even if their symptoms don't fully align. To avoid these errors, clinicians must remain vigilant, questioning their assumptions, considering alternative explanations, and seeking supervision or consultation when needed. By acknowledging the potential for bias, clinicians can strive for objectivity, ensuring their assessments are thorough, accurate, and ultimately beneficial to their patients. Section 9. Honing the craft. Practice makes perfect. Mastering psychiatric assessments is an ongoing journey, not a destination. Like any skill, it requires practice, reflection, and continuous learning. One effective way to hone these skills is through role-playing exercises. By stepping into the shoes of both clinician and patient, individuals can gain a deeper understanding of the assessment process from both perspectives. Another valuable approach is to observe experienced clinicians conducting assessments. By carefully observing their techniques, questioning styles and interactions with patients, individuals can glean valuable insights and refine their own skills. Attending workshops, conferences, and continuing education courses provides opportunities to stay updated on the latest research, assessment tools, and best practices in the field. By embracing a commitment to lifelong learning and actively seeking opportunities for growth, clinicians can continuously refine their assessment skills, ensuring they provide the highest quality care to those seeking their help.